Hi everyone, this is Dr. Carrie Lane. I am your faculty for this course, DNP 820. I want to give you a good introduction for the course and some vital information for some upcoming assignments. And I have another mini lecture on this topic as well, as far as other ways to be very successful in this course and the rest of your courses. So just so you know a little bit about me, I've taught at all levels of programs and in multiple universities over the past 21 years. I am currently an associate professor on the tenure track for the University of Missouri and Columbia. I teach pathophysiology, nursing fundamentals, geriatric nursing, and you can see the rest. I also write grants and do research, and that's what makes some of my experience really nice for this class and others as we get you directed towards your DPI projects. So DNP 820 is a challenging course. It's really one of the first courses where you begin to focus more intensely on your DPI projects, and so I think you'll see that the rigor increases incredibly during this course. We'll focus on those projects and move your project and ideas forward, and of course we keep the course fairly action-packed, as GCU typically does. To get started, just post an introduction of yourself on the class wall, post an introduction in your groups discussion page. Actually, I don't think we set up any groups, so don't worry about that. You should update your profile in LoudCloud. It's nice if you have a picture there, just so I can start to get used to seeing your faces, and it just personalizes things a little bit. And then, of course, read the syllabus, make note of all your assignment due dates. You'll also want to be familiar with the DC network to locate forms and templates, and there's other resources there about your DPI projects as well. So this class has 3 assignments that are directly related to your DPI projects. You'll want to make significant progress towards your DPI projects here so that you can be in the best possible position when you hit DNP 955. So your 10 strategic points, your literature review draft in week 4, and the literature review draft part 2 in week 6. So a lot of times students will come to me and say, well, my faculty person didn't give me any feedback on my last 10 strategic points. And so what should I do? I mean, how do I add anything? How do I change it? The 10 strategic points is an outline of your project thus far. You want to add substantially to what you have, even if there were no previous feedback provided. So what I mean by that is expand your literature, add more articles, add details in the outline form, add the results of the studies, because that's your evidence, and we'll talk about that in a little bit later. Expand that outline quite significantly. And then in week 4, you're going to write your literature review draft in paragraph form based on those 10 strategic points. So your main key points in the 10 strategic points of the literature review section will be expanded into paragraph form. Your final version of this is chapter 2 of your DPI project, and it will need to be over 30 pages and have at least 50 references. Your reviewers are quite specific, and they will be very literal, so you must have 50 articles cited. That's 50 different articles cited and 30 plus pages. You also, when you do your literature review draft, will want to expand even further from the 10 strategic points and include your evidence in the results. So include the statistical results, the p-values or confidence intervals. Tell us what the evidence says so that the reader can make a decision on how to interpret those results. And then the part 2 document, you're going to expand and add additional literature, and it's all based on feedback from week 4. So you want to take your comments that I gave you in week 4, modify and change your document based on those comments, and then add additional references. I ask that you have 15 references in week 4, and you try to double that to 30 references by week 6. And then you'll still have to improve that again before you hit DNP 955, but you'll do that on your own. Now, other things that are important to remember about your DPI projects: you must have an intervention that you implement. You must measure a patient practice outcome that's not education. You could do education and a patient practice outcome, but you can't do education alone. That's one of your key variables, and it can't be retroactive, meaning you cannot measure the effect of an intervention that has already been delivered. You also need to have data that demonstrates a need. So that means you have data that says you have a lot of transfers at your facility. You have data that says you have a lot of HAPIs or CODIs, increases in urinary tract infections, increases in central line infections. It doesn't have to be a huge change, but you definitely want to know that you can make an improvement on what is actually occurring. So you need to clearly demonstrate that an outcome that has improved patient care will impact the patients. That means it comes from the literature. Your evidence, which is the literature, says that this has worked in other places and this is why you want to implement it at your site. Remember that a change in knowledge is not acceptable as your only outcome measure, and quality improvement should always be the driving force. Now, frequently people get kind of panicked here at this point because they've thought of something that they thought would work, and now their idea doesn't meet these guidelines. Just really make sure that you can add some type of patient outcome measure, and it'll be fine. So take a look at what you have, think about what you can do to measure for patient outcomes, and go from there. So in conclusion, use your resources to make this class a great one. Please let me know if you have any questions. My cell phone's listed here, and you'll also find my email in other areas as well. I'm looking forward to working with all of you. Good luck.